If you have a history of poor bowel prep in the past, if you have diabetes or cirrhosis, if you have a history of gastric bypass, or if you take medications like opioid pain medications, this is a bowel prep that is going to help better ensure that you get a good clean out. We call this our extended bowel prep. Remember, if your colon is not properly cleaned out, they might have to tell you to come back and do this whole process again. So it's really important that you follow these instructions as best as you can. For our extended bowel prep regimen, you will start by changing your diet to a low residue diet starting 5 days before your scheduled colonoscopy. So for example, if you're scheduled on a Friday, that dietary change would happen on Sunday. You'll continue eating a low residue diet that we'll explain here in a minute for 4 days in a row. Those would be Sunday, Monday, Tuesday, and Wednesday. But on Thursday, the day before your colonoscopy, you'll do a clear liquid diet all day. You will also take Miralax, 2 doses daily for those same 4 days that you're doing your low residue diet. You will also take 2 doses of Dulcolax the night before your prep day. So between the Miralax and the diet and the Dulcolax, you should have a good bowel movement the morning of your prep day. That makes the whole prep process so much easier. If you have diabetes, you may also be asked to take a dose of Reglan 1 hour before your first bowel prep dose. But if that is so, it'll be written on your instruction sheet. These instructions will also tell you how to hold or adjust your diabetes medications prior to the procedure. If you take injectable medications for diabetes or weight loss, including Mounjaro or Ozempic, these will likely need to be stopped a week before your procedure. So again, make sure to follow your instructions closely. And a low residue diet is really pretty simple. You just have to avoid whole grains, seeds, and nuts. You can eat white grains, including white bread, white rice, white potatoes, white pasta. You can also eat meat and dairy. But you'll get a handout that goes through a list of things that you can and cannot eat, so make sure to follow that list closely. If it's not on the list, try to avoid it.
Some examples of low residue meals include scrambled eggs, a turkey sandwich, a baked potato, pretzels as a snack, or applesauce. The day prior to your colonoscopy, you'll change your diet again to a clear liquid diet. So no solid foods this day, but we want you to feast on fluids. You can have things like water, tea, lemonade, Gatorade, Powerade. You can even have coffee, but please don't put any type of creamer in it because dairy is considered a food. You can also have things like popsicles or Jell-O. Just make sure there's not any fruit in them and nothing red or purple. When we say feast on fluids, we really mean it. Do your best to drink a lot of fluids prior to drinking your bowel prep. If you're even a little bit dehydrated before you start, it'll make drinking the prep a lot harder. So drink lots and lots of fluids throughout the day.
Starting at 6 p.m. the night before your procedure, you'll start drinking the first dose of your bowel preparation. If you happen to be off work and want to start this process a little sooner, you're welcome to start the first dose of your prep between 4 and 6 p.m., but definitely make sure to start it before 6 p.m.
Also remember that depending on what preparation kit you're given, you may need to mix your prep with water. If this is the case, make sure to do so about an hour before you need to start drinking it, so you can put it in the refrigerator to chill. It's always easier to drink your prep when it's cold.
But please do not drink it too fast. Your mind might like the idea of just getting it down, but your stomach won't. So don't chug it. Drink it slowly. It should take you about a half an hour or even longer to complete this first dose. If you get a little nauseated, feel free to slow it down. It can also be helpful to chase it with something that tastes a little better or even just some cold water. I found it helpful to use a straw and then follow it with cold water. The solution can be quite concentrated, so the contrast of the cold water was actually pretty nice. But if you're not a water lover, you could follow it with something like Gatorade or lemonade, but definitely try to avoid carbonated beverages because all those bubbles will make you feel more full and uncomfortable.
Feel free to drink as many clear liquids as you like after completing your first bowel prep dose, and make sure you stay close to the bathroom.
The second dose of your bowel prep will start at some point in the early morning hours on the day of your procedure, but that time will vary depending on what time you're scheduled to arrive. So make sure that you follow your instructions for this dose and make sure to set your alarm. This dose is just as important, if not more important, than the first dose. Follow the instructions with tips as we just mentioned.
And when we say cleaning out your colon, we mean it. By the time you finish, your stool should look like lemonade without a lot of other debris.
You can continue drinking fluids up until 4 hours before your scheduled procedure time, and that time will be identified on your instruction sheet. If you take medications for your heart or blood pressure, make sure to take those before your cutoff time. Please arrive at the endoscopy center at your scheduled arrival time, and make sure to bring a driver with you. They will not sedate you if you don't have a driver present.